Hey, I'm Joe. I'm be a physical therapist today and be assessing your wound. First, I'm just gonna ask you a few questions.
Okay.
How did this burn happen?
I spilled some hot water at the coffee shop I work at on my arm.
And how long ago did this happen?
2 days?
Alright. And were you taking any medications prior to the burn?
No.
And when the burn happened, was there any clothing or anything covering it?
No, I was wearing a tank top.
Okay. And what have you done to make the wound feel better?
Other than just making sure nothing rubs up against it or nothing touches it, nothing else.
And you would say your health is fairly good, correct?
Yep, I think I have good health other than this.
And do you have, from the burn, has anything happened where, you can't do your normal day-to-day stuff, functional impairment?
Other than that, no.
Okay. And you got your tonsils removed when you were younger, correct?
When I was 10, yep.
All right. And for your medications, you're taking Percocets, correct?
Yes.
All right, so that's actually going to be a little bit helpful because it can improve the wound healing because you're not going to have as much pain, so you can tolerate the treatments a little bit better, okay? And you are a grad student full-time, correct? Yep. And you work part-time at a local coffee shop, right? And you live on a second floor apartment with your 2 friends.
Yep.
And you work out on occasion at the gym.
Yep.
Awesome. So, being a grad student, I'm assuming you're not getting enough sleep, right? Because I know how that feels. And with that, you can be tired and you might have a few mistakes during the day, right? So that can affect the wound healing. Also, working at the coffee shop, you're going to be exposed to these hot water and coffee. So that could actually put you in harm's way, okay? So now I'm just going to run through a few tests, right? So for cardiovascular, I'm going to do examination of the peripheral pulses, blood pressure, heart rate, and capillary refill. That's just to make sure you're getting adequate blood flow into the area so the wound can heal. And due to this being a scald burn and it being on the arm, I'm not going to do any respiration tests, okay? And for musculoskeletal testing, I'm going to check the range of motion of the wrist, fingers, elbow, and shoulder. So right now I'm going to do range of motion of the elbow, so I'm going to check the unaffected side first. So you can put your left elbow on the towel. And due to this being film crew on the other side, I'm just gonna move over and check the range of motion here. And got about 4 degrees right there. And I'm gonna check flexion, so if you could bend your elbow. So that's about 140 degrees there. And we're gonna check the other side now. So with extension, this is the affected side. So this is also about 4 degrees, where the normal would be about 180. And then we're gonna flex the arm. Where the normal will be about 0 degrees. We're gonna flex the arm. And then over here we also have about 140, where the normal would be about 150. And since they're the same on both sides, there's no problem with range of motion. And then for neuromuscular, we're gonna do reflex testing, sensory, so we can check like the difference between hot and cold, vibration, and pressure. So I'll show the hot and cold sensation right now. So I'm gonna grab these 2 water bottles. So this one's gonna be the hot and this one's gonna be the cold. So we're gonna do it on the unaffected side first, all right? So like I said, this is hot, yep. This is hot and this is cold, so feel that, hot. All right, if you could turn your head away, tell me what you feel.
Hot.
Yep.
Cold. Hot. Cold.
All right, perfect. Now if you bring your affected side over, we're gonna do the same thing, turn away.
Hot. Yep. Cold. Hot. Cold.
All right, nice job. So that's the hot and cold sensation. And for the, I would do a nutritional assessment just to make sure that there's not any malnutrition so that the wound can heal properly, right? Okay. And I would not perform any urogenital tests. Okay, so now we're going to the wound exam, and the burn extends from the dorsal hand just below the wrist, sparing the fingers and the thumb, extending to the dorsal aspect of the right forearm and half of your dorsal aspect of your arm. So to measure the wound, I'm going to use the TBSA percentage using the rule of 9 model. So the dorsal forearm is 2.25%, and half the dorsal aspect of her arm is about 1.13%. So if I round up, this comes out to about a total of 3.4%. So the wound bed and percentage, so there's erythema, the red, moist, pink, shiny skin all around. I'd say there's about 90% of the wound, and then the blisters here, these like little bubbles, are about 10%. There's no noticeable wound edges. There's a difference in the skin at the distal part of the forearm, right about here, and there's serous exudate in the blisters. There's moderate drainage because upon removal of the dressing, there's a thin, clear, watery drainage on the inner side of the wound dressing, and minimal on the outer aspect of the wound dressing. Some drainage on the wound bed after dressing's removal, and some drainage after prolonged treatment. So this wound type is a superficial partial thickness burn. It's a scald burn too. So wound debridement is appropriate for this wound because of the fluid containing blisters. So those same blisters right over there. They should be drained and the skin debrided so that the true depth of the wound can be evaluated. We're going to treat this wound with a topical antimicrobial medication and non-adherent gauze. So we'd use this gauze so it does not stick to the healthy skin won't come off when you take the gauze off. And when the exudate goes to minimal drainage, we will include semi-permeable film. So these burns are at risk for infection, which is why we give them the antimicrobial medication. And if needed, we can use splinting to prevent the wound contracture. Okay, so for the patient education, I'm going to need you to watch out for a few things. So obviously exposure to hot water, right? When you're taking a shower, try not to get the water too hot and get it on the burn. And especially when you're at work, be careful for the boiling water that's there, the coffee, or bumping into anyone. Obviously watch out for the clothing too, right? So any contact on the burn isn't going to be too good. And exposure to the sun times. Right now it's the summer, the sun's pretty strong. You really don't want to get too much sun on the burn, okay? And then moisturize the wound area, okay? And some long-term challenges that you could have are modular ulcers, okay, which is like a cancerous ulcer, post-traumatic stress disorder and or depression. So many of these injuries are life-changing experiences which can lead to physical adjustments that cause severe psychological stress. So what we can do sometimes is actually use a virtual reality to stimulate important daily tasks, right? And as well as motivate people to kind of get back into it. There's greater emphasis on the restoration of activities of daily living. So like the normal things that you do, like brushing your hair, waking up, sleeping on that side, stuff like that.